In health news, diabetes impacts more than 34 million people in the U.S., and 1 in 5 Americans don't know they actually have it. But according to the American Physiological Society, black people make up nearly 12% of all cases compared to 7.5% of whites. Joining us now to discuss the disproportionate effect of diabetes has on the black community is fourth-year PhD student at the University of Wisconsin-Madison, RASHAUN Williams, and professor of endocrinology diabetes at Metabolism at the University of Wisconsin-Madison, Dr. Don Davis. And thank you both for joining us, and welcome to BNC.
Thank you for having us.
Hi.
We are happy to have you too, and your titles are a mouthful, so we know you're doing important work for us. And so, Dr. Davis, we'll start with you. Can you explain to us the difference between type 1 and type 2 diabetes? Many folks don't actually know.
Sure. So type 1 diabetes is what used to be referred to as juvenile diabetes. It's diabetes that's most commonly diagnosed in children, and it's an autoimmune disease. So basically the body attacks its own cells and destroys the ability to make insulin. Type 2 diabetes, on the other hand, is the much more common. It makes up about 80 to 90% of all cases of diabetes. And type 2 diabetes actually is a disease of aging. It shows up more as people get older, and it's associated with obesity. And what happens with type 2 diabetes is that you might still make insulin, but your body doesn't use insulin as well. You're insulin resistant is the word we use.
And RASHAUN, you've actually been recognized for your work for what you're doing with this by the American Physiological Association. What have you actually learned about why are black people disproportionately impacted by diabetes?
So I've learned so far that there's many socioeconomic issues in regards to the understanding and knowledge of diabetes. A lot of black Americans and African Americans tend to be disproportionately affected by diabetes and not have the literacy and communication to properly access the healthcare needed for treating and understanding the disease.
Mm-hmm. And Dr. Davis, you know, diabetes isn't necessarily hereditary. For example, a lot of folks actually, you know, a person can actually develop diabetes during pregnancy or as they age. Explain how this happens, and can this be reversed?
Yeah, so diabetes, you're right, can present during pregnancy or with aging. And as I mentioned before, what those both are related to is what we call insulin resistance. When you're pregnant, you're naturally more insulin resistant. Mm-hmm. And as you age, you're naturally more insulin resistant. So the ways to try to prevent this are to do the best we can to try to improve insulin resistance overall. And that involves trying to maintain a healthy body weight, trying to eat healthy, exercise, and do all those things. But I would caution to say that, despite all of that, some people do have a predisposition to diabetes, and it can be very difficult to completely avoid it. So we want to avoid this concept of like blaming people who have diabetes because they didn't try hard enough to have a healthy lifestyle.
And why is it that people of color are so impacted by it? And that's a follow-up question for Dr. Davis.
Sure. Yeah. There's a lot of reasons, and I think it's a really complex question. As RASHAUN mentioned, part of it can be socioeconomic factors. Part of it can be hereditary factors. Part of it can be chronic stress. There's evidence that systemic racism and other factors that are experienced by Black folks can lead to elevated levels of this hormone cortisol, and cortisol can promote insulin resistance and make people more likely to develop diabetes.
And RASHAUN, how can you actually prevent diabetes from occurring? I know this is the work that you are learning right now, being a fourth-year student, but how can it actually prevent it? And what is some of the work that you want to see done in order to help stop it?
So one of the things I think is extremely beneficial, both in the scientific community and outside, is lessening on the jargon. I would like to pursue a career in science policy and potentially better the science literacy and communication of individuals from locations like myself, from the Bronx, so people have a better understanding of what diabetes is, how they can treat it, and then they could benefit themselves and also everyone around them.
Yeah, and asking you this also, RASHAUN, rap pioneer Biz Markie has been very vocal about his battle with diabetes over the years and health complications. Just how fatal can diabetes be?
Oh, diabetes can be extremely fatal. My mother, in fact, also has it. And Black people and African Americans in general have a much higher likelihood of dying from diabetes as opposed to other races and ethnicities. So it's an incredibly fatal disease, especially because of the comorbidities that can come alongside with diabetes.
And I mean, and as you mentioned that it runs in my family as well. And Dr. Davis, what should people with diabetes be asking their doctors? And when you're going, you have these questions, what should they ask so they can kind of have an early prevention, if you will?
Right. I think, as RASHAUN hinted at, how trying to improve your health literacy is a really big step that people can take to try to read up and learn more about diabetes and understand what the goals and the various treatments are. What is really important to prevent some of those complications in the long run is to have good access to healthcare and to, have your doctor make sure that they're providing you with the medications that you might need to keep your blood sugars under control and to prevent risks of heart attack and stroke and other complications related to diabetes. And to understand, again, whether you're meeting those goals and if your blood sugars are running too high, to seek help and try to, get that under better control to prevent the bad consequences in the long run.
And we know that obviously having diabetes can be costly. In 2017, the cost of diabetes was roughly, $327 billion, rather. Why is diabetes so costly? RASHAUN, if you could speak to that.
Yeah, so there's many issues alongside of the medications that come with diabetes. For example, insulin costs are massive in the United States, as well as several other medications, such as sulfonylureas, I can't say it, metformin, as opposed to several others. But yes, there's lots of issues in terms of diabetes and financials.
Yeah, definitely. So hopefully everybody's been listening and getting some prevention tips, and we appreciate both of your time tonight. Thank you, Dr. Davis, and also thank you, RASHAUN, and good luck with your career. We appreciate your time tonight.
Thank you.
Thank you
Take
very
care.
much.
Thank you.
Bye-bye.